6:43 right now. In just a few days on October 1st, the sign-up begins for Americans who don't have health insurance. But a lot of Americans are really confused about how this is all going to work. The Fox Medical team's Beth Galvin joins us live from Atlanta. Good morning, Beth. Now, you say the most important thing is not to panic.
Exactly, Jose, because you have some time and you have some options. The actual enrollment period starts on the 1st, which is Tuesday, but you're going to have 6 months until March 31st to make a decision. And you should be able to go online on the website healthcare.gov on Tuesday and kind of see your options, but you don't have to do anything right now. Consider your options. There will be navigators who might be able to help you. You can find one in your area by searching on that healthcare.gov website. But a lot of people are feeling very confused, but I really hope that they do not feel panicked and they know that they have some time. Jose?
Yeah, there is a lot of confusion out there, but what if you have insurance through your place of employment or Medicare? Do you need to do anything?
Well, if you have, no. The bottom line is if you have insurance through your job or your spouse's job or you're signed up for Medicare, you already have coverage and you don't need to shop on this insurance exchange. If you do not have insurance and you fit within certain income brackets, or you are self-insured and your family is self-insured and you're just looking for a better deal, you do need to pay attention to the exchanges. Jose?
Now, in order to sign up, what information do you have to have with you?
So you're going to have your basic financial information. You can get that from your tax forms, your W-2 forms, your current pay stubs. You're basically going to be projecting how much you're going to make in 2014. And based on that, they will decide, what kind of plans you'll be offered, what kind of a price cut you might get, what kind of a tax break you might get. The good news is a lot of people may qualify for a tax break that will offset some of what you're going to have to pay to get coverage. Jose?
With all of the plans being offered, how do you determine what kind of coverage you would need for yourself?
Well, I think you need to think about cost. That's going to be probably foremost on everybody else's mind. But also, what are your medical needs? Do you see a doctor a lot? Do you have a medical condition? Are you relatively healthy? Do you have a lot of prescriptions? That's going to help control, what kind of a plan that you're going to buy. There will be 4 levels of plans. And so, some of the plans are going to have like a very low deductible, but you're going to pay a higher monthly payment. Or you can pay a low monthly payment, but you're going to pay more when you go to get care. And so it kind of depends on what your medical needs are. You also want to make sure that your doctor and your hospital are going to be included in your plan, because you don't want to sign up for a plan where you can no longer see your doctor. So just know that you have time, know that you have options, and really get on there and weigh your options. Jose?
Well, it seems like there are a lot of things we're going to have to think about before we actually signed up. But how do you know if you can qualify for some tax credits to pay for your coverage?
Well, that is going to be based on your income, and there will be a pretty large zone of people who are struggling, people who really feel like they cannot afford to get coverage may qualify for some kind of a tax break. I would really suggest when you go on the site on Tuesday or after that, signing up to meet with an insurance navigator. That's somebody who can help you go over your choices. They're being trained by the government, so they're kind of an independent person who's not trying to sell you any one particular plan. And you can meet with them over the phone, you can meet with them in person, and kind of go over what you qualify, what you don't qualify for, and what kind of plans are out there for you and what your best choice may be. Jose?
Great information, and you've kind of straightened out a few things. We do have time. It's just we have to use that time very well. Thank you, Beth Galvin in Atlanta.